My name is Igor Weisz. I'm a board-certified psychiatrist, and I'm here today to talk about anxiety and depression and what patients might encounter in the first few sessions with a psychiatrist. I have been trained in two countries, actually. First, being born and raised in Europe, I went to medical school in Germany, and that's where I became a psychiatrist the first time around. Life was very different. It was a different century, a different millennium, a different epoch in European history, which I found at the time to be not very satisfying. America had an allure that brought me here ultimately. So coming here, I was delighted to see a number of new therapeutic modalities sprouting, which was a very different scene from what I had left behind. But ultimately, I realized that my place is in psychiatry. So I took all the required exams, did the required additional education, and became a board-certified psychiatrist here in this country as well. So I've been practicing here for the last 25, 30 years now. In private practice, working for county, working for the state, pretty much. When a patient comes in complaining of anxiety or depression, and they are in need of treatment, the first most important thing to do is to take a good history. Ask about current symptoms, about the development of the current symptoms, recurrence of past similar symptoms, family history, medical history. All of that plays a major role in psychiatric history taking. The next step is then to, of course, arrive at a diagnosis. And based on that diagnosis, be it in the group of depressive disorders or anxiety disorders, the treatment will be initiated. There are current efforts moving forward in the field of psychiatric research in which the genetic makeup of the patient will help pinpoint the medication that would be most effective from the get-go. But that's not yet a mainstream approach. So unfortunately, initially we start with what is called medication trial, which is to say that there is no guarantee that the first choice of medication might be effective. And therefore, a quick succession of meetings in the beginning is very desirable to monitor progress. As a psychiatrist, my job is to appreciate progress, meaning control of the symptoms, improving the clinical status of the patient, versus side effects. Side effects can be minor, like a little bit of dry mouth or a little bit queasy feeling in the stomach the first few days, and then none, all the way to rather debilitating weight gain, depending on the medicine. Weight gain or somnolence, meaning lethargy, sleepiness. So if the side effect burden becomes too heavy, one has to review the usefulness of that medicine and maybe consider an alternative. As I say, that's today still the old medication trial, but we are hopeful that within a short time, new methods will become available. Now, I would like to expand a little bit on the way in which medications might be helpful when people suffer from anxiety or depression. It's been discovered about 70 years ago that certain medications are effective in modulating mood states and in decreasing anxiety. Initially, it was not known how they do that, but over the decades, more research revealed that the many brain cells that we have, hopefully still have on their membrane, on their outer surface, receptors for certain chemicals. We call those chemicals neurotransmitters. And manipulating the amount of neurotransmitters coming in may have a beneficial effect ultimately on the mood. How exactly that happens is still not known. Like it's a step of maybe 100, it's a process of 100 steps. We know maybe 5 or 10 of them. But the clinical outcome is that symptoms decrease. If the right medication has been found, then what is to be expected that ongoing anxious ruminations or panic attacks that come out of the blue and cripple a patient's ability to function because they are already thinking of the next one and how embarrassing that would be in a social setting. All of this can be alleviated quite dramatically. The same applies for depressive disorders. Coincidentally, it is pretty much the same group of medications that help in both conditions. The more detailed physiological mechanisms maybe go a little too far at this point, but suffice to say that if the right medication is found, within a short time, a patient's ability to function, a patient's ability to enjoy life is being restored again. And more often than not, I think quietly to myself, if I were a better salesman, I could sell this to the industry and they would be glad to have a new advertisement. But I'm not a good salesman, so I don't do that. Now, how long does one expect to be on medications is an important question that might be on the mind of most everybody who comes in. It is a dreaded vision that one would have to take the medicine for the duration. That's not necessarily the case, although it depends from case to case. Some cases of anxiety or depression are caused by acute stressors. When the stress is over, it's a high likelihood, if the person functioned well before, that they will return to the previous level of functioning. If it is a more chronic, meaning long-lasting condition that has been untreated for a long time, chances are that a longer treatment might be in order. Medications should be given for quite a while after symptoms disappear to make sure that they remain that way, which is to say that they do not recur. While that is a very understandable recommendation, I notice that oftentimes patients would love to be off their medications ahead of time. I am ready to negotiate that because I don't see too much benefit in keeping them on medications a long time after symptoms have disappeared or resolved. However, it is also true that symptoms may resurface if treatment is cut short. So it is important to observe a certain duration, which varies from case to case. And for the patient, it is also important that they remain compliant and take the medication as prescribed. It is oftentimes, it is quite known among practitioners that compliance is not as, generally among patients, is not as stellar as reported in the session. It is possible that the medication only helps partially, and some intensity of the symptoms decreases and they feel a little better, but there is room for improvement. In that case, we're talking what the practitioner, the psychiatrist, will do in that case is referred to as augmentation of the treatment. And there are various ways to go about that. By adding a second agent of another antidepressant or a different medicine that goes well with the original treatment in order to obtain more of a result. And beyond that, there are non-pharmacological ways to enhance the treatment. Statistics show that the combination of medication treatment with psychotherapy reveals the best results. As far as psychotherapists, there are many different schools of thought. Cognitive behavioral is nowadays much favored because it shows good results and quite timely so. Besides medication treatment and psychotherapies of the different orientation, there are additional ways in which the patient themselves could augment or enhance the treatment. Some of these ways are readily available, such as physical exercise. It has been shown that physical exercise by itself has an antidepressant effect and lowers levels of anxiety. Lifestyle changes are the context in which we put this. Physical exercise, diet, proper lifestyle in general, not staying up too late, and, very important, cutting back on substances, alcohol or drugs. I know cannabis is nowadays legal, and there is a myriad of subgroups of cannabis that are supposed to help. I was raised with a more conservative view of cannabis, and during treatment I would recommend to be very easy on that, also on alcohol and other substances. People who use harder drugs, they don't need to be told, they know it themselves that it is detrimental to stability of mood or absence of anxiety if they go on binges again. In some cases, quite a few actually, psychiatric symptoms are caused by an underlying medical problem. And in those cases, treating the underlying medical problem and looking at the side effects of the medications that treat that medical problem is of great importance. The psychiatrist will, in such cases, contact the primary care doctor or the specialized internist and maybe discuss ways to optimize treatment, and that is an important thing, particularly with elderly folks, because older people in their 50s, 60s take increasing numbers of daily medications for blood pressure or other conditions that they may have, and those medications themselves can cause psychiatric side effects. And how to control that and optimize that treatment, streamline it so that they are most effective while with little load of side effects is of great importance. After explaining the basic approach of a psychiatrist to a case of depression or anxiety, I would like to add the following. While what I said is accepted clinical practice, it may fall a little short of some patients' expectations. Why? Because nowadays people have an increasingly more spiritual approach to their lives or to everything that is pertinent to them. And I would like to encourage that by saying that for the last several decades, there have been an increasing number of approaches that validate the value of spiritual orientation for the purpose of expediting the healing process. And there are a number of ways to go about that, a number of therapies that emphasize that aspect. So if the previous explanations sounded too medical, I would like to reassure people that the spiritual component is regarded as increasingly important. In summary, what a patient may expect when they seek psychiatric treatment is that they will be asked about their current situation and past history. A history taking is essential for the psychiatrist to understand the nature of the current presenting problems. Along with that, a medication trial will be initiated according to the best experience of the psychiatrist and the clinical presentation of the patient. A medication, an antidepressant, might be selected that might hold the promise of working best. As I said before, at this time we are still relegated to or bound to medication trials, but we have high hopes that in the near future genetic studies will pinpoint the most effective of the available medications from the get-go. In the following sessions, the psychiatrist will most likely evaluate the progress of the treatment by looking at the rate of decrease of symptoms and weighing that against the load of side effects. If side effects are too discomforting or intrusive in some way, or just uncomfortable, then maybe a different medication might be selected, even if the current one is doing a fairly good job. In addition to medication treatment, there are a number of ways in which the process can be helped. A major one is psychotherapy. Oftentimes, the psychiatrist will make a referral of the patient for therapy with a therapist. And the goal will be, depending on the case, to help a person manage an acute crisis or help a person manage long-standing symptoms or problems with a new approach. These are so far interventions done by trained and specialized and licensed practitioners. In addition to that, the patient can make some lifestyle changes, and through dietary changes, including regular exercise, living healthier lifestyle overall, and importantly, controlling their use of substances would be very important. And finally, I should remark that streamlining ongoing medical treatment for medical conditions not related to psychiatry is also an important issue. The psychiatrist will look into all the other medications with an eye for their psychiatric side effects, and maybe contact, as the case may be, the treating physician.